The Work and Pensions Secretary Mel Stride spoke recently about economic inactivity being one of the great challenges to the labour market. Within that, long-term sickness among working-age adults has been growing. Mel Stride told The Telegraph last month that while he is grateful for today's much more open approach to mental health, there is a danger that this has gone too far. He is reported to be intending to change the rules so that only people with the most severe mental health conditions can be signed off work. When we looked at this subject in the latest Today debate, the president of the Royal College of Psychiatry, Dr. Laddie Smith, said this.
We know the conditions over the past 10 or so years have really made it difficult for people. Financial insecurity, debt, housing insecurity, and more recently since the pandemic, loneliness and isolation. And what it means is that more people are more likely to have depression and anxiety. And so what should have happened is we should have provided people, knowing inevitably that we were going to have more mental health problems, we should have made sure that there was a strategy to support those people.
And we're joined now by Mel Stride, who is the Work and Pensions Secretary. Good morning.
Good morning, Michelle.
What is your thinking on whether the guidance on mental health and capability to work needs to change?
Well, it is something that we are reviewing and bringing in some changes there. And I think what we need to be having is a grown-up and sensible conversation about where we're going with mental health. And what I mean by that is it is very good news that we are more open about discussing mental health. There are far too many people who suffered in silence in the past. However, I think we also need to look very carefully about whether we are beginning to label or medicalise conditions that in the past would have been seen as the ups and downs of life. We all go through difficult times in our life. That is regrettable, but it is part and a natural part of the human condition. So I think we need to have a grown-up debate about it. Now, none of that is to suggest that there aren't additional pressures that have contributed to mental health problems. And your clip there talked about COVID and lockdown and so on, and that's true. And I would add to that, incidentally, particularly for young people where this has been a growing problem, social media and the impact of that. But we do need to have this grown-up discussion, not least
clear,
because the numbers are going up very strongly.
Well, yes, absolutely. Paul Johnson was talking about that to us earlier, that the numbers receiving incapacity and disability benefit have gone up. It's mostly mental health in younger people, physical health in older ones. It's clear from what you're saying that your review would make it stricter. There will be some people who are signed off work for mental health reasons today who would not be.
I think at the heart of the approach that I'm taking is perhaps it's an old-fashioned belief, but I think it's one that needs to come back into fashion, is that work is good for you. Work is good for your mental health. Getting up in the morning, have a sense of purpose, interacting with other people in the workplace, having that conversation at the water cooler or whatever it may be, is good for our mental health. And there is plenty of evidence that shows that. So my mission is to get as many people into work as possible. And I care the most about those who can benefit from work in the way that I've described. And that's why I'm reviewing the process by which people go into these long-term benefits.
Some people will be quite afraid. From what you're saying, they'll be afraid. They'll worry that someone close to them who is really struggling is going to struggle further by being put under this kind of pressure.
And that is why we need to have assessments done in the right way with properly trained professionals in a very clear and methodical and sensible approach to that. And that's why we've taken a lot of time to consider these matters very carefully. But we can't leave things the way that we are. And I equally worry about that person who is feeling a bit depressed or a bit down, something that there's been an event in their life that's caused that perhaps. They drop out of the workforce. They end up months in, month out, not working. They stay at home. They get more depressed and a cycle starts. I want to break that cycle. And the way that we're doing that is we're bringing forward big fundamental welfare reforms that are about helping those people into work. For example, something called universal support that will help people and place people in work and stay with them for a whole 12 months to make sure that they hold down those jobs. Something called Work Well, so that if you go to your doctor saying you are feeling a bit bluesy, rather than being perhaps signed off, you actually go to somebody who's able to sit down with you and look at both your health care requirements, but also the work element, Michelle.
Okay,
the work element as well.
One person doing both, because that is an interesting thing. And actually in our recent Today debate, There was an interesting point raised about how for the most severe conditions, the system is quite good. It's other things, it's depression and anxiety, where there isn't the kind of joined-up approach that could make a real difference.
Well, we're bringing forward exactly that. It's something called Work Well. When I first became Work and Pensions Secretary, one of the first things I did was sit down with my team, with my officials, and say, look, we've got to break this cycle of people going to a GP and then just ending up being parked on benefits through time. That is not right, and I don't want that to happen.
They can't access they can't access things through the NHS. They can't, they're not getting talking therapies or access to a specialist in a timely fashion.
So I'm trying to set out how we are making exactly those changes. So Work Well, which is going to be stood up in 15 of the 42 different health areas in the UK towards the end of this year, will bring together healthcare, including mental health care, at the local level, along with work coaches alongside, so that you can do both things. Now, you mentioned talking therapies in the NHS. In the last fiscal event, the Chancellor funded 400,000 additional talking therapies in the NHS. And that's exactly the kind of treatment we can bring forward. And the good news, Michelle, is if you combine work with that kind of therapy, the evidence is that it works. It's good for the economy, but it's good for the individuals too.